In this video, we are going to show you how to remove drugs or other solutions from an opened ampule when using AO+, with a syringe and needles in a completely safe manner that prevents possible needle stick injury. You will need a syringe, blunt filter needle or filter straw, an injection needle of appropriate gauge. You will also need the patient tracking label specific to your patient drug instructions for the ampule and syringe, if you need them. Having opened the glass ampule already, we are ready to withdraw the drug from the ampule. As we do not have to hold the ampule, we now have two hands to operate the syringe. First, partially open the sterile packaging of the needles. Then place a blunt filter needle on the syringe. You should always use a filtered device to ensure that no glass fines enter the syringe. Make sure it is firmly on. Remove the needle cap and place it in the needle holder on the AO Plus base vertically tipped down. We have made the cap holding port large enough to accommodate the typical sizes of needle caps. Then, using two hands to hold and operate the syringe, guide the needle into the opened ampule until it reaches the bottom of the ampule. Withdraw the contents operating the plunger with your free hand. Once you have emptied the ampule, withdraw the syringe and needle from the ampule. You have now successfully removed the drug or compound from the ampule with no spills or exposure to possible glass sharps and needle stick issues using AO+. In order to use the syringe to inject a patient, the filter needle must be removed. Holding the syringe vertically, needle up, pull the plunger slightly down so you can remove all the liquid from the needle. Now install the cap onto the needle by vertically holding the syringe and guiding the needle back into the cover in the needle holder and press down. Withdraw the syringe and check that the cap is firmly on. Now remove the filter needle and discard in a sharps container. Install a correct gauge needle onto the syringe, loosen the cap slightly, with tight caps, be careful to avoid rebound injury by applying pressure with the thumbs at the base of the cap. When the cap is loose, now hold the syringe vertically. Applying slight pressure to the plunger, remove any excess air that's in the needle and syringe. The syringe and needle are now ready to inject. Remove the cap and place it into the needle holder and inject the patient. Replace the cap on the needle by repeating the cap replacement procedure and make sure the cap is firmly on. The syringe and needle can now be disposed of in a sharps container. The base can now be picked up and the neck and empty ampule can also be disposed in a sharps container. Once you've disposed of the body and the broken neck in a sharps container, place the base back on the bench and the opener back onto the base, and AO Plus is now ready to reuse. You have now observed how to remove a drug from an opened ampule using AO Plus safely, using the optional needle holder system. By using these necessary steps, you will protect yourself from glass sharps and needle stick injury. For greater information, visit www.theampuleopener.com today.